Welcome everybody. My name is Lorelei. I'm the Marketing and Communications Manager, and we're excited to have Dr. William Buchholz with us today. Dr. Bill is a medical oncologist and was educated at Harvard University and Stanford Medical School. He's been practicing in the Los Altos area from 1978 until 2014 when he retired. Since then, he has continued to lecture to professional and lay groups about advanced care planning, the End-of-Life Options Act, and conducted workshops to help people, before they become patients, have more control over the medical care they receive when they are facing potentially mortal illnesses. He serves on the senior commissions of Los Altos, the Medical Ethics Committee of El Camino Hospital and Santa Clara County Medical Association, and he was chosen as a Changemaker Fellow at the Los Altos United Methodist Church. His project was Creative Aging. Welcome, and thank you for joining us today.
There's a lot going on now with the COVID vaccine. A central issue that was brought up at the last roundtable was the vaccine hesitancy, and that really prompted me to look at that. There is a handout, and do you have that, Laura, that is available to people that I sent in?
Yes, we can share that.
Please.
Yes.
That includes a lot of the information that I might otherwise talk about today. I update this probably a couple, 3 times a week because things are changing at that rate. One question that comes up, and I will go into vaccine hesitancy later, is the variants and what do those mean? Viruses, all viruses mutate. They're reproducing either their RNA or DNA viruses they're sloppy in their recreating an exact copy. So these mutations occur, and it is now caught the public attention of 3 groups of mutations, one ascribed to the United Kingdom, one to South America, specifically Brazil, and one to South Africa. All of these have demonstrated some reduced response to the vaccines. And I'd like to emphasize that all of the vaccine companies are addressing this by either producing booster shots or tailoring their vaccine in addition so that the potentially faster spreading or more dangerous in terms of a severe case, that these are addressed, and watch this space for the next news. All of the current vaccines, and specifically Moderna, Pfizer, SmithKline, and J&J, Johnson & Johnson, have been tested with the serum from people who've been vaccinated and from people who have actually had an episode of COVID disease. Actually, COVID stands for coronavirus disease. And so we talk about COVID as the virus, but that's easier to pronounce. And so the standard way that a vaccine is measured is how dilute can you take a person's serum after vaccination, and it will still neutralize whatever the particular target virus is. So for the RNA-based viruses, the titers are 10,000 or more. So a 10,000 dilution still has neutralizing activity. The decrease in activity drops no lower than 300. So you could still make a 300 dilution, and the vaccines would still be able to neutralize these variants. Now, the variants are basically spawned in people who catch COVID. So the unvaccinated group is particularly a breeding ground for variants occurring. So that's why the vaccine hesitancy is such an important issue, since we need at least 75 to 80% of the country vaccinated to get herd immunity. And that's vaccinated, not just having had COVID, because the immune response from an infection is good for 90 days or so. Now that varies from person to person, but people expect to be around for more than 3 months after catching COVID. The mortality rate has dropped, and that is, I think, because of decreased infections and better care. When this virus appeared on the medical landscape, it was so novel that the doctors did not have really a good sense of what drugs to use. And so there's been a very steep learning curve, a very successful one, so that people are treated before they become literally deathly ill. There's obvious groups that are more frail and susceptible to serious disease, and those would be exactly the groups that you take care of. I'm 75, so I actually fit in that, and I have been both my vaccinations some time ago, as has my wife. The issue of other countries, particularly third world countries, not having vaccine means that their populations would be also unvaccinated. And again, potential sources of these variants that have the capacity to evade the current treatments. So, I mean, this is a big deal. There are two basic kinds of vaccines available. One, the Moderna and Pfizer, is based upon isolating the virus RNA, and it's an RNA virus, not a DNA virus, so it can't screw up our own genome. That messenger RNA vaccine then programs directly the mechanisms in the immune system to make antibodies against whatever the target antigen is. The other vaccines, which sometimes use either bits of protein or use a virus that is inactivated, but that will enter human cells, like a neutered cold virus, will carry in the segments of the protein to be immunized, and then that allows the cell to make copies of that as it reacts and basically has immune response. Now, the immune response isn't just the serum, isn't just the liquid antibodies. The T cells, as well as the B cells, also are involved in ways that at least I haven't read their exact mechanism. They're critical parts of the overall immune system. So just knowing that they also respond to vaccination or to infection is important in assessing overall immunity. And many of the studies are done in vitro, meaning in the lab. And all of those reports say, but this must be confirmed on human studies, or at least in vivo, meaning animal studies. One recently published set of studies was done on gorillas, I think, or monkeys, and showed some interesting information I can get to later. The side effects of these viruses really have to be, from my point of view, at the forefront of talking to people about vaccination, because this is foremost on their mind. And the mythology, the purposeful misinformation or disinformation has basically prevented large groups from wanting to be vaccinated. This was the vaccine was politicized in the last administration. So that has been a sizable group that consistently reports 20% of people would never be vaccinated. And I'll cut to the chase. There was a report 3 days ago of a focused group led by a Republican pollster, if you will, and selecting only people who said that they were reluctant to take the vaccine. He was able to, by acknowledging all of their issues and staying absolutely politically neutral in the fact that anything that had a whiff of a democratic or any kind of liberal position was toxic. So that people were willing to be educated, and educated from a friendly, i.e. Republican source, that it changed their minds. And so they are now accepting vaccination, or at least have stated that they will. I understand that Trump has announced that he was vaccinated in January. So that may also be a useful datum that would change minds. But that's not the only group that is reluctant. I have a neighbor who's from Iran, and there's a large community in Los Angeles, and they have been susceptible to all of the disinformation. And so when I was talking with him on the driveway before I was going to go back to Los Angeles, he had all of the kinds of nonsense, misinformation, and I didn't have time fully to sit with him, quite literally, and listen in detail to what his thoughts were. But that is the critical part of any conversation that you might have with caregivers or with patients or anybody else that you know who is reluctant to be vaccinated, that they must feel witnessed. They must feel that you absolutely are open without thinking of what you want to say, but just listening to them. You can prompt them with something that would encourage them to speak more, but it has to be that they feel the trust of somebody who will listen to them. The kinds of hesitancies often have a twisted source. So, for example, people were saying that they were afraid of the vaccine changing their own DNA. And that had to be distinguishing between DNA and RNA, which are different, though they are in the same kind of reproductive system. Also, that there were microchips that would plant in your body that would be used for nefarious purposes. Well, there are microchips, but they are on the cardboard boxes of the vaccine bottles. And so obviously those are not part that will be injected in your arm. But things of this sort where there is a statement that is misinterpreted that can produce these kinds of resistances. And I went through on that handout kind of a list of ways that people might be motivated to be reluctant. There are huge populations in this country, which comes as no surprise to you, for whom the medical system is not a friend. They have difficulty having phone calls returned. The Tuskegee Experiment, quote unquote, is still very much present in African American minds. The lack of being treated as a responsible adult by caregivers also makes many people of color and other minority groups suspicious. So if you are dealing with any of those populations, it's important really to find out what information they're using to make decisions. And asking about other kinds of decisions that they make, like what kind of car they're going to buy, or what brand of tofu they're going to buy. Those are important, kind of getting to know you and know how you think. And I think that's basically the job of anybody who is working directly with people. The comment about the study in, I believe it was gorillas, was published just yesterday. And interestingly, do you know what long haulers are, or long COVID? There are a, quote, significant number of people who continue to have really unpleasant symptoms long after they've recovered from the acute infection. Brain fog, respiratory symptoms, lack of energy, drowsiness, all other kinds of respiratory symptoms besides shortness of breath. And so they followed a group of people who were these long haulers, as they're nicknamed. And that they checked them at 1 month and 8 months and drew their serum, or excuse me, they vaccinated them at 8 months, because as I mentioned, there's a 3-month window where the antibodies that you produce from infection are available to you. And so they tested their serum against in apes or monkeys, I forget which, and it decreased. I'm sorry. And in vitro, no, I'm misremembering. The people were interviewed a month after vaccination, and consistently the vaccinated long haulers had a reduction in their symptoms, whereas the unvaccinated did not. And in some cases, their symptoms were worse. So this is another benefit, besides to the individual not getting sick, even if we've got better medicines to keep you from dying. Tonight, I'm going to be speaking to the Medical Association Ethics Committee on this topic, and presenting vaccination as an ethical question. Because if you think about it, if we can't get herd immunity until other people are vaccinated, our being vaccinated is for other people's benefit. And so the ethical issue boils down to the ethical values of autonomy, of beneficence, meaning doing good, non-maleficence, meaning doing bad, and, if you will, justice, so that the treatment that a person gets should be available to everybody else equally. So the people refusing to be vaccinated are in effect creating a breeding ground for new mutant variants.
Yeah, I believe you.
And hence it is their lack of identifying other people as those whom they would help because of their belief systems. This is not true in Europe, I can tell you. I just came back from visiting my daughter and her newborn, my 6th grandson. And in England, 95% of the people are eager to be vaccinated. And so it is a United States issue far more than anything else. And the cultural value of autonomy, I'm a rugged individualist and I'll make my own decisions, is the breeding ground for honoring I'm doing this for myself because that's what our culture says we're supposed to be, rugged individualist. And Mark Twain once said, you can't reason somebody out of something that they weren't reasoned into. And so when you're having conversations, a logical approach, until you understand what the person's mindset is not going to be effective in convincing them. I will use this ethical argument that you care about your partner or your children or your grandchildren and don't want them to be harmed. So you can help them by you getting vaccinated, because this will lead to, again, herd immunity.
Dr.
It pretty well covers the kinds of things that I knew to talk about.
Dr. Bill, I had a question regarding children, because I know many of us have kids that are under the age of 16. What do you foresee happening with vaccines for that age group and how that's going to help with herd immunity?
Right now, the value that is driving the thinking is to prevent people from having serious COVID. And so the priority are going to be, as you heard, older people, people who are at risk because they're first responders. And by the way, the police and the sheriffs of Santa Clara County also have some people reluctant to get vaccinated. So I'd really like to talk with them because they're as likely to run into somebody who's unvaccinated as doctors would. So the way that you approach a person really has to be also over time in order to, one, get them to change their mind, and two, to get the CDC to change its mind. Because the CDC, because it really is one of the foremost scientific bodies in the world, looks at the way that the studies were done, and the youngest person in those studies, in Israel it was 16, and in the United States it was 18. So they don't want to step outside and color outside the lines on that until there are data.
Mm-hmm.
And again, with the value system of preventing serious illness, a lot of countries are going to a single dose, even of the vaccines that are double dose, because the first shot after 14 days shows on a graph that's in the handout that there is protection against being infected at all, or at least having symptoms, and particularly being protected against serious symptoms. So it's not the optimum for an individual, but it gets to the point where whole cultures can become safe faster. And again, the limit here was distribution of vaccine, and the limit, I guess, anywhere is the production capacity. So as more pharmaceutical companies have their vaccines okayed by the CDC, no, it's actually it's not the CDC, it's the federal government, the FDA. So there will be probably enough vaccines for the countries that did not, quote, complete the vaccination for the 2-shot ones, the Moderna and Pfizer particularly. The J&J is a 1-shot deal. And I don't remember with AstraZeneca, which was done through Oxford University in England, is a 2-shot or not. So the children, and I have 4 people in my family who are under the age of 3. And 3 more that are under the age of 16. So that it's very much a real thing about protecting them. The schools are protected at school because they take strict mask and distance guidelines seriously. Other questions? Linda, didn't you have a question that was submitted?
I had a question that was submitted, Dr. Bill. So the question was, why are many of the people I've talked to experiencing more side effects after the second dose of their vaccine? I had no side effects for my first vaccination shot, but the second shot caused pain in my muscles, chills, nausea, and extreme fatigue. This is similar to other side effects I've heard about.
What you heard is absolutely true. That the degree of intensity of a side effect and the number of side effects does increase with the second shot. The reason for this is not absolutely clear. There were people who had severe allergic reactions to the first shot, and this was particularly the mRNA, the RNA viruses, the Pfizer and Moderna, because one of the things that stabilized the vaccine was polyethylene glycol, PEG, which is in a lot of other medications and substances. And so these people often were primed, if not by that specific, but by other allergic reactions, to have a much more serious one. The side effects are random. The only way I knew I was vaccinated is I had to take off the Band-Aid in a couple of days. I had no nada. My wife was tired. My son-in-law had fever and chills and anorexia. Certainly other friends have side effects. So is there a way of protecting against side effects, particularly at the second shot? Advil, aspirin, Tylenol, all can decrease the fever and the pain. But some of these other side effects, their mechanism is not absolutely clear. What is clear, it's the body's response to it. And so you have all of the immune system jacked up. And by the way, did you know that the flu vaccine, actually, that it isn't the flu virus that causes the symptoms, it's the body's response to this virus, jacking up the immune system, cytokines, like you've heard of interferon? There's a bunch of long named and generally abbreviated with numbers substances that the white blood cells and other immune competent cells secrete. And those are the ones that make you feel crappy and basically can trigger a fever. The fever is that you've got a temperature regulation system up in your brain, and that gets triggered by these substances. So it's something to do with the immune response, but it's just not worked out yet. So I give only a partial answer, but the good news is, as you and probably your friends noticed, the side effects go away very promptly. And it is the long haulers for whom it isn't the side effects persist, it's the symptoms of the COVID itself. And it's hypothesized that this has something to do with the immune system. But this is not a published paper, and it was just an opinion from an immunologist. So I take that with a whole box of Morton salt. Other questions? There are other problems that you've had in your job, either with clients or with other vendors or whatever?
Yes, I have a question, Dr. Bill.
Yes.
So we do have home setting clients who stop wearing their mask because, both caregivers and the client have been fully vaccinated. Do you know what the current CDC recommendation is, or what the right thing to do is at this time?
If everyone's been vaccinated, then small groups, which could be a single family, or in this case, a caregiver and there probably several caregivers, are okayed for mask off and not at 6 feet. I found the CDC guidelines a little confusing. And you have to get the backstory, if you will. Because if you read the guidelines, what they don't say is that people who have been vaccinated or have had COVID can get reinfected. And it is hypothesized, but not proven by any means, that what's happening is a variant is, quote, reinfecting them, but it isn't a reinfection of the same virus. It's a variant of that initial virus, or what they would call the wild type or the original one. So it's for that reason, if you read those guidelines, they always say you shouldn't have anybody who would be in danger of serious illness or serious disease. And that's the underlying issue of the guidelines. So that's why they'll let you be with an unvaccinated person if you've been vaccinated fully. And as long as they are not elderly with diabetes and COPD or any other comorbidities. So what you're seeing, Christine, is a normal CDC sanctioned behavior. Anybody?
Thank you so much.
Oh, you're welcome.
How long has there been any research on how long the immunity with the vaccine? Sorry, it's Laura.
Laura.
How has there been any research done about how long the vaccine will basically be effective before having to get a booster?
Well, as you might gather, the vaccines were only started in December.
Mm-hmm.
So that kind of question takes literally time to answer.
Mm-hmm.
It is known that the immune response drops off after roughly 3 months for people who have had the disease, symptomatic disease. It isn't absolutely clear, at least in my mind, whether people who were asymptomatic have the same degree of immunity as those who were symptomatic. And people will argue, well, we don't know the long-term effects of the vaccine, but we do know the short-term effects of getting COVID. You're sick as the proverbial canine. Other folks? Yes. Talia. Or not?
Onorato.
Or nato?
Yeah, you got to raise the hands.
Did I get,
Good morning, doctor.
Everybody in the Mediterranean raises their hands.
Well,
If you have arthritis, you're mute.
well, thank you for being here this morning. And I guess I'm curious, as a healthcare provider, I am, even with both doses, I could still catch COVID again and potentially spread it. Can you shed more light onto that?
Yes.
Thank you.
Well, yes, there are people who have been vaccinated who have positive throat tests. Now, the more important issue is, what is their viral load? Meaning, how many viral particles are actually in them, in their throat, that they could spit out in some fashion. So that has not really been researched, at least in anything that I've read, whether the viral load is kept low because the vaccine has created enough immunity that it inhibits virus multiplication. That is certainly one of the hypotheses that's going around. But again, I'm trained as a scientist, so I like to see the randomized, double-blind, controlled study. But by the way, did you know they have never done a randomized, double-blind, controlled study on parachutes to prove that they work? That's a joke. A rather morbid joke, but there's some places where common sense, which isn't always that common, and an understanding that something is true that is also an important guide for your actions. So it is certainly possible, as we did with going to London, to be have testing time and time again for COVID. And so we now, in the space of 3 weeks, have 6 negative COVID tests. And by the way, they charge in England, so it's not free. So that would be, if you have that concern, I think that at least you can get a free test. Stanford does that, and they do it in your car. So that is a way of kind of reassuring yourself that at that moment you did not have any virus. But it doesn't obviously speak to 3 days later after you've seen a new patient. And that's how it is right now. Other questions? So I'd like to know more about what you folks do. And are there ways that I can be helpful to you? At least not necessarily as a direct medical provider, but at least in the research and the stuff that I've learned. Yes.
I think all of us work, or I would imagine one of our biggest concerns is educating our caregivers about the vaccinations and the benefits. There's such a great percentage that are unwilling to receive the vaccination based on their religion, based on misinformation, and we are not able to enforce the vaccines. But breaking through that barrier of communication has been such a great challenge and continues to be.
That's exactly what Mr. Lutz, who was the Republican pollster, found out, is that you had to speak to people and give them information so that they feel that it's their decision rather than being pushed into it. And again, in my handout, I've listed both the side effects and the good effects. And there is a very, very persuasive graph. This will not appear all that good, but this is the line of the unimmunized in the studies. This is the line of the people who were immunized, who developed in these, hundreds of thousands of people, developed symptomatic disease. And I think that you can see at this point, which is day 14 after the first shot, that there's a difference. And so this is one of the best visual aids anybody could use. But you then still have to answer all of the misinformation. The Kaiser has a website that they do, and I have that on my handout, my currently updated handout. And it really goes into detail the groups who are likely to be resistant. And so when you are looking at these groups, you probably have some sense if there are people who are in a minority group and not wealthy, that they have been turned off by medical care. So when you deal with that, the suspicion is, how did this vaccine get okayed that fast? It must have been cutting corners. No, they cut red tape. And so the reason that the vaccines were developed is that they stopped having administrative and bureaucratic obstacles in doing the studies. So if they stopped all those obstacles, we would see a whole lot of at least cancer drugs okayed faster. So again, having answers to the reasons behind the hesitancy. And if somebody has one reason that they're afraid of microchips, they have two other reasons also. And you might also add that the anti-vaxxers have been researched and found that at least 80% of them have financial interests about promoting this belief. Either they have products that they sell or websites that they want traffic. So again, impugning the source of the misinformation, discrediting it, or at least finding out what it is. And when somebody says, oh, I read it on the web, not every recipe that you can download is tasty. So again, treat people as smart as you are. Perhaps not with the same background of education and experience, but because you all know that that's a human being in front of you. And the courtesy of treating them with respect. And I know that there are difficult people. Actually, I don't know if it's the person that's difficult, it's the relationship that's difficult. And so how to break barriers and establish trust. I know that in my medical practice, that if I did not establish trust, and I had an advantage, I was wearing a white coat and had some academic wallpaper on the hallway. But the trust issue, and I think that it's valid to even ask, who do you trust? And the answer, at least by the Kaiser group, was medical personnel and clergy. And by the way, one of the physicians on the ethics committee, who was very active in Catholic healthcare, he's a thoracic surgeon, I believe. And he ran into the religious reason amongst Catholics that there was at some point stem cells derived from fetuses. And if you will dial the Pope's number, you will find out that he is specifically encouraging people to be vaccinated. And I don't know that it's an encyclical, but it is a public response from the top. So that, yes, you don't have to raise your hand, just keep speaking.
So sorry. So what are your thoughts about things opening up so quickly? I'm San Francisco based, and it just appears that people are starting to open their doors, and the media is saying, oh, this time is over, better days are coming. It just seems so very quick.
It is definitely not the recommendations of scientific bodies. It has become political. Florida, Texas, several other Republican-led states have just basically thrown all restrictions off. And my bet is that they will see a surge. The virus is way smarter than we are. So when you see behavior that, even if you've been vaccinated, is a potential source of reinfection for you, I mean, you know, slap a mask on your face and turn the other way when they cough. And being, again, it's the air circulation that allows the quote fomites, the little particles of saliva and virus to spread. And so if the air circulation outdoors, you see a lot of people outdoors without masks, and that was true in England also. But indoors, everybody wore a mask in England. So spring break in Florida is the super spreader since the motorcycle rally in, I guess it was North Dakota. So we will be seeing upticks in the number of people infected. You know, you can't make somebody smarter if they're not willing. And that's part of the tragedy of living in a social system that gives people more sense of autonomy than of community. Yes, Renata. By the way, are you related to the group that has a mortuary?
Oh no, actually I'm not. I've been asked that question, and
I'm sure.
used to, you know, say, "Oh, Renata Tibaldi, the opera singer from way back." But anyways, no, not related. You would know that maybe. Not related. So my question's in relation to the variants, and for those people that have had the vaccines. I know you talked about this, and I guess I'm just looking for probably clarification or reassurance, or you know, I guess the CDC will be telling us as they come up with numbers of people who've had the vaccine and then are exposed to a variant and then can still get it. I'm just looking for more information on that.
I have that, and including the citation, online citation, so that you can look for yourself.
Okay.
And that's in the handout.
Okay.
I actually, Christine, did I give you the most recent handout?
Yes.
What day was that? 2 days.
I can check.
I'll send the one that I've updated today.
Okay.
Because the information coming out is daily. The studies are confirmed in vitro, meaning in the lab, that the vaccines are neutralizing at a titer of 300 or more to all of the variants. Well, all the dangerous ones. In order to prevent the new variants from becoming even less effectively neutralized, we've got to stop producing those new variants. And that's the crux of getting people to accept vaccination. Nobody on screen was old enough to get the original polio vaccination. I was, and I said I'm 75. There was still a lot of people getting polio when I was a kid. And so for that vaccine, there wasn't any question whatsoever that people would get that. And they just lined up for shots. Kids didn't cry because they knew that this was something that was very good for them. And that included, toddlers. So all we can do is deal with reality as it is right now. And I had a sign on my exam room wall, trust goodness. And just as there's bad things, there's good things. And the idea that people can actually trust that goodness will happen for them depends on a lot of variants, including personality type and experiences and so forth. One of my patients pointed out that there was a typo in that sign. And you say you have too many O's in it. It should be trust godness. And that concept, if you have a Judeo-Christian or any religion that has deities, that the concept of that is operant in the world may be able to be trusted with less hesitation. And so that is one of the ways that it keeps me from, I'd say, tearing my hair out, but that's not an option for me. We must keep ourselves from despair. And so the risk of disappointment when we hope for something does not cancel the beneficial effect of hope. And we have the capacity to make a decision, low battery, make a decision on what we choose to think. So we don't always remember that. I've been meditating for over 50 years, and it's still sometimes comes as a surprise to me that I could actually think something different. So that's what we can do for ourselves. It's been an hour. It went fast.
Yeah.
Again, I want to emphasize, if there are ways that I can assist the success of what you do for my peer group, I am happy to help out in any way that I can.